Hello and happy Friday. WebCME wants you to start your weekend with a win. This week's Clinical Connection is Total Contact Cast Part 2. Once again, I'm joined by Dr. Jeffrey Jensen. Jeff, welcome back.
Thank you, Jeff. Glad to be here.
Listen, by popular demand, you're back for Part 2. Last week's segment was outstanding and very well perceived, so thanks for doing that.
You're welcome.
So we talked last week about the theory behind total contact casting, especially a consensus statement that you guys published.
Right.
That was excellent. Great recommendations. Talking about total contact cast and healing diabetic foot ulcers. If you haven't reviewed that article, I would suggest that you do. Jeff, let's take a little clinical transition now and talk a little bit more about clinical applications of total contact cast. I am certainly a fan, but you know, I'm sure you hear it frequently. I do as well, walking through conferences and different settings for clinicians. The main complaint is total contact casting is great, but it takes too much time to do. What's your answer to that?
Well, it's hard to argue with that, and that was true years ago. I've heard many different clinicians say that it takes up to 45 minutes to apply a traditional total contact cast. And when you add on top of that, there's a learning curve on how to do it. It certainly can disrupt the flow of the clinic,
Right,
so I can understand why they say that. I will say that when we developed TCC Easy, one of our goals was to enable a cast to be applied in a timely fashion so it doesn't upset the flow of the clinic.
Right.
And different studies that have been done with the TCC Easy have indicated that it is easy to learn and it is quick to apply.
You know, a lot of clinicians have talked about this. Greg Bond is a great advocate for Total Contact Cast Easy. And Greg has his applications timed down to less than 8 minutes.
Yes.
So clearly you can't say that 8 minutes is too much time for healing a diabetic foot ulcer.
Exactly, and you also have to remember that the doctor's time is actually the amount of time rolling the cast, which is significantly less than the prep time.
And that's what we do in our clinics. We work as a team. The prep is done by the nursing and technical staff, and then the physician comes on to roll, or nurse practitioner comes on to roll the final layer. So that's outstanding. And I congratulate you on the Total Contact Cast Easy system. It's just fabulous.
Thank you.
So let's talk a little bit more about you know, the monetary part of it. Obviously, you know, we're working to heal patients in the wound care clinic, but there's always a financial component to this. Many procedures and things that we do for healing are not well reimbursed, and we actually lose money. Is the total contact cast system part of that money losing? In other words, are we going to lose money every time we do this, or is it reimbursed?
Well, there's a long history for reimbursement on casting, and if you had asked me this question 10 years ago, I would have told you that it's a break-even initiative at best. But over the last 10 years, CMS has acknowledged that the TCC is a standard of care, and they've continued to increase reimbursement. So the hospitals are well reimbursed in outpatient settings at this point, in wound care centers, and also the physician is well reimbursed for the application each time.
You know, you raise an interesting point. I think as CMS recognizes the effectiveness of offloading, total offloading with the Total Contact Cast Easy system, that reimbursement is only going to continue to go up because it is so cost effective.
Absolutely. If you're looking at the cost of applying cast to the point, at the end point of being healing of the wound, total contact casting is probably the most economical way to treat a wound.
So, you know, Carolyn Fife has done a lot of great work in this area. She's published several papers, one asking the question, why is it so hard to do the right thing? Another recent paper related to standards of care and outcomes. Why is it so hard to do the right thing? What is your thought?
Well, I think we see that a lot in medicine, and in our little area of wound care, you see it with venous insufficiency wounds with compression therapy, and probably one of the hallmarks of that is offloading. And technically, we know that the wounds need to be offloaded. Some of it's an educational challenge, but the other part is realizing that there is a gap between what is in the literature and what is shown to be best practices and what actually translates into the clinic. So trying to narrow that gap is really a challenge, and it's one of the reasons we developed the TCC Easy.
So the consensus paper says that the evidence is there to support total contact casting. You've talked a little bit about the financial rewards that are available to us, and most importantly, the clinical outcomes, the healing that is associated with total contact casting, the efficiencies achieved with the EasyCast system. There's really no doubt in my mind that this should be standard of care, and I'm sure you agree with that.
Well, I think you're going to see its utilization increase due to all those reasons you just mentioned. So Thank you very much.
Well, Jeff, once again, thanks for your comments.
My
Appreciate
pleasure.
having you on WIN.
Appreciate it. Thank you.
Well, that's this week's WIN. We hope this content will enhance your clinical practice. Please continue to follow us and send us your questions and comments on Facebook, Twitter, or LinkedIn. Jeff and I hope that you have a safe and relaxing weekend.